Good afternoon, everyone. Greetings. Today is Monday, June 1st. It's hard to believe that it is June. Thanks for joining us today. We're glad that you're here to get updates on what is happening with COVID-19 in the area, to get current information on our cases and what we're doing about those as disease spreads in our area and across the state. I'll give you some status updates from the state, and then Angie Weideman is here with us from Chippewa County, sharing a little bit about what is happening in Chippewa County related to COVID-19. We're really happy always to be able to show to you how we work regularly, daily, across county lines, not just with Chippewa County, but with counties all around us. We have people every day that have contacts of cases that are in this county that live in other counties, or vice versa. We also have cases that may travel between counties regularly, and we have to make sure that we get them in a specific county and staying there for their time of isolation as well. So it's good to have Angie here, and she'll be sharing some additional information with you. Today at a state level, we have negative cases of 253,595 people have been tested for COVID-19, and those are negative tests, an increase of 3,492 negatives since Sunday. Positive for COVID-19 tests are at 18,543, an increase of 140 since Sunday. 14% of those that have been positive have been hospitalized at any point in time. That's 2,603 individuals. And we now have 595 people, Wisconsin residents, that have died of COVID-19. Another increase, again, 3 more since Sunday. Again, the positivity rate for Wisconsin is staying fairly consistent. Their testing numbers overall across the state continue to be strong, and testing continues to happen in our state, both community-level testing as well as outbreak testing, and that is an important part of our response to COVID-19. I will now share a little bit about Eau Claire numbers, and then after that, Angie will come up and share Chippewa numbers. So first of all, our Eau Claire numbers, our negative tests are 4,778, an increase of 221 negative tests since Friday. Positives are at 113, 3 more than Friday. Recovered are at 85. Do note that as of today, we are starting to report to you the numbers that are actually on the state website, just for consistency and to avoid confusion. Again, we typically have reported to you the active cases or contacts that we are working on a daily basis. Some of those people end up being counted as cases eventually in other counties. And to avoid the confusion about our numbers, we are now at these media briefings sharing with you the numbers that you also see at the state. The state website shows some of those fluctuating numbers because, again, as they clean data, they move cases to the right place and the right county according to an address that they utilize at that point in time. Doesn't mean, Angie and I both know that it doesn't mean that we haven't done all the work for a specific case, and it happens always in our counties across the state, but it does mean that it gets counted elsewhere. We are following up on a lot of cases in Eau Claire. While many of them have been reported as recovered, those cases continue to grow. And each case, the contacts are significant. And so making sure that people are staying home after they're identified as a case and making sure their contacts stay home is how we stop the spread of disease. All of our decision metrics are also on the website, which does include a lot of information about cases and what we are doing with those cases. So that's a place to look, have updated information weekly. So not only are our counts there, but all of the decision metrics as we move forward with our order are also there. So I will now turn it over to Angie, and Angie's going to share a couple of things with you, and then I'll be back to give a couple of more updates and answer questions.
Thank you, Lisa, and thank you to the Eau Claire City County Health Department for having me today. Good afternoon. My name is Angie Weideman, and I am the Health Director for Chippewa County Department of Public Health. I'd like to start with a few updates about local case information for Chippewa County. Chippewa County currently has 57 positive cases of COVID-19. We have 46 individuals that have been released from public health isolation and 11 individuals that we are currently monitoring. We have 2,850 negative test results, and Chippewa County has also released a data dashboard online, which will have all of the numbers that I've reported, and we do update that Monday through Friday. You can find that dashboard by going to the county website and going to COVID-19 information page and clicking on cases by county. June is Dairy Month, and it is June 1st. I want to acknowledge that we have entered Dairy Month. As someone that comes from a farming background, I understand the importance of farmers and agriculture to our local economies. The past few years have been very difficult on farmers, and I want to share that UW Extension has information on many resources for farming families. This includes information on recent financial opportunities from COVID-19 related legislation, as well as information related to mental health. Please contact your local ag agent from UW Extension for more information. A question that a lot of people ask me is, why is it important to wear a mask? Our health departments recommend wearing cloth face coverings while you're in public spaces to help stop the spread of COVID-19. Face coverings are recommended because COVID-19 spreads via respiratory droplets, meaning these droplets that come out of your nose or mouth when you cough, sneeze, talk, yawn, sing, etc. Cloth face coverings provide an extra layer of protection to help keep the respiratory droplets from traveling into the air that other people come into contact with. We urge you to wear face coverings in public, particularly when physically distancing is difficult to do. This means spaces like restaurants, grocery stores, pharmacies, retail shops, and hair salons. We are also asking you to consider reasons why people might be wearing a face mask. There should be no stigma associated with wearing a face mask. Maybe that person that's wearing the mask has a husband that's going through chemo treatments. Maybe they live with their grandparents. Maybe their child has severe asthma. Maybe they work at a hospital or a grocery store or a first responder, and on their time off are thinking about how they don't want to get their coworkers sick. During this difficult time, we want to be kind to people, and wearing a mask is one simple act that you can do to be kind to others. There are scenarios where individuals should not wear a face covering. They should not be placed on children under age 2, or anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. To conclude, I want to thank you all for joining today and caring about public health, and Lisa will now come back to give more updates on Eau Claire County.
Thank you, Angie, for sharing that. I will tell you that I was out this weekend, which I haven't been much, but I was out with my 19-year-old son, and 19-year-old boys are not really fond of doing things that make them look a little different, but he wore a face covering when he was with me, and it's not about him. It's not about me when I'm wearing a face covering. It's about the people that are immunocompromised. It's about the people that live with people that are immunocompromised. We are protecting them. We need to be a team in Eau Claire to protect others because we are choosing to wear that face covering. So again, think about it when you go out. It's not about yourself. It's about you who may not realize that you have COVID-19 and are asymptomatic largely, but it's about protecting other people that you come in contact with if you're nearby. So again, my 19-year-old wasn't necessarily fond of wearing a face covering when he's out, but he does. And I think all of us need to put that in perspective for the people that we love in this community. And this is a tight-knit community. We care about each other. A couple of additional updates for all of you. Many of you are aware that there was a peaceful demonstration related to the rally related to George Floyd over the weekend. That rally was downtown Eau Claire. There were many people that were gathered. Again, First Amendment rights are something that we hold as important. The virus does still exist. We encourage people, if they are choosing to go to rallies, if they are choosing to have peaceful protests, to think about physical distance and to wear a cloth face covering. Those two things will help decrease the risk. It will not eliminate the risk. We hope people find other ways to express their thoughts, particularly for those people where risk is significant for being out in a large group. We've gotten many questions about it. It's certainly a concern and a risk, but we also understand that it's important to have voice in these times. Also, this weekend and coming up will be warm weather. This weekend may be not so warm for some people, but this coming days will be warm as well. Our health department does have a practice of testing the water of all the beaches, and will continue to do that. Beaches are open in Eau Claire, but they are also open with very clear indication that physical distance and keeping with your household is what is expected in those spaces. Again, we want to stop the rapid spread of COVID-19, and those outdoor spaces are wonderful assets in our community. Pay attention to them being safe, both the safety of the water. We do beach testing. Right now, the water is safe, and those tests have happened, but we test regularly, and the website at the health department is a place to go to get information about that testing of the water itself, not for COVID-19, but for all the other things we test for. But also, when you go, pay attention to COVID-19 as well. Some of the beach safety reminders that we will tell you are: keep 6 feet apart from other groups. Don't swim by yourself, certainly as a general recommendation, but don't go to the beach if you are ill and you are someone that shouldn't be exposing others to disease. All of those other regular safety things like staying hydrated, protecting yourself from the sun, washing your hands often, those are all important tips to stay healthy at the beach as well. Last week, we also reported on long-term care facility and outbreak investigations at long-term care facilities. That term, outbreak investigation, happens anytime there is a positive at a long-term care facility. I want to note that anytime there is a positive at long-term care, there's something good happening. They are testing and making sure that we are preventing the spread of disease. All of us in this community want long-term care to be testing. We want to make sure that we identify people that are positive for COVID-19 quickly, and we make sure that those people are isolated. In Eau Claire and across the state, long-term care facilities have been working tirelessly to prevent disease spread in their facilities, and we need to continue to support them in the work that they are doing. By testing, they are helping us do that work, and we want them and need them to continue to test. We expect that there will be positive cases in long-term care facilities, and those workers don't stay at that facility and not get exposed to other people. So just like the rest of the community, we know that there will be positives. That doesn't mean that that long-term care facility is doing anything wrong related to their practices internally. And we need to make sure that we catch those cases early. Supporting long-term care facilities and being successful is critically important. We know that across the nation and across the world, people that are elderly and in those compromised conditions are where we're seeing the most fatalities. So long-term care facilities doing the right thing, testing, using PPE, making sure that their residents and their staff are protected is critical. And we're fortunate in this community to have such strong facilities doing the right thing. So again, an encouragement to go to our website, covid19eauclaire.org. There is a lot of information there for individuals, for businesses, for those that want to know more. You can also, if you go there and you don't get all the information that you do need, please call our call center number. That number is 715-831-7425. It is staffed Monday through Friday, 8:30 to 4:30, and certainly if you leave a message, we also get back to you if it's outside of those hours. So, questions that people have today? Yes?
With more new cases, almost every day here in Clark County, I wonder if you could comment on, if any county residents have been hospitalized. I know you can't say particularly, but if you could just in a very general sense.
Yeah, so the question is about whether any county residents have been hospitalized. I don't have that information in front of me. We don't track hospitalizations at a county level. So we would expect over time that there are likely people that will be hospitalized with COVID-19, and that's tracked, again, at a point in time per case at the state level. Any additional questions? Yes.
As you talked about contact tracing before, I'm wondering if, as people start to go out and think maybe more, if per case the circles of contact are starting to get bigger than you guys are.
Yeah, the question is about contact tracing, and are we seeing, as people are out and about in the community more, are we seeing more contacts, more people that have to stay home because they were in close contact with an individual that's a case? We are tracking that over time. We've just gotten that metric, that number available to us on a regular basis from our system, and we are seeing increasing numbers. That is one of the things that we'll be reporting on regularly. And right now, we are slowly seeing those numbers increase. It's very case dependent, as you can imagine, but we've had some cases where there are lots of contacts and others where there are very few. Again, the smaller the circle, the better for that individual and, frankly, for all of the people around them. That's one of the reasons we want people to keep physical distance. If you keep physical distance and you are not considered a high-risk or a medium-risk contact, even if you were in the same room, people in this room with me would not be considered contacts of mine if I am positive. And that's because we're a long distance away. Anytime people get closer, they then risk that definition of meeting close contact. So the fewer people that can be together and the more physical distance when you are together that you can have, the better it is. It's part of why we are really encouraging people to keep their networks small. Wonderful. Thank you for joining us today. We appreciate your time. We will be back on Friday. That is a change in our regularly scheduled media updates with this format. We will be answering questions on Wednesdays, so there'll be direct connect with Incident Command and with the Health Department on Wednesdays through that format, but we will be back live on Friday, and we'll be doing that twice a week moving forward. Thanks for your time, and thanks for what you're doing to keep people around you healthy.